Hello, everyone. This is the Kills Health live stream with Dr. Nelson. I am your host, Dr. Nelson. How are you doing? I am in Central Florida, and I am not a friend of the frigid temperatures in the winter. So it's a nice 72 degrees in Florida today. Where are you coming from, Brian?
I am in Virginia and it's a bit colder. It's like upper 40s, maybe 50, somewhere in there. So,
All righty. So please put in the chat where you're watching from. And if you have any questions for Brian as we talk, please put them in the chat as well. Ideally preceded with a QQQ. And that way I will try not to miss them. And if I miss a question, just put it up again. Not a problem. Uh, all right. So we're diving deep today into the carnivore lifestyle with Brian Nowicki of Week Goes Carnivore. That's his YouTube channel. I should mention right now, go and find it and subscribe to it if you're not a subscriber. Brian has a fascinating story. He has lost around 85 pounds and has improved conditions like atrial fibrillation, which many are told cannot be handled except for medications or electrical ablations, which is major procedure basically. So we're going to be talking to him a little bit about that. How are you doing, Brian?
I'm doing great. How are you doing, Dr. Nelson?
All righty. So go ahead and introduce yourself a little bit for those who may not have heard you. You've been with us before, uh, but go ahead and introduce yourself. Tell us a little bit about your story, which involves a few things like improving atrial fibrillation, which is amazing.
Yeah. Okay. So, thank you for having me on. I am 52 years old now. I just turned 52 here in about, oh, it's like 2 weeks ago. Um, I started on carnivore back in July 1st of 2022. So, I'm about little over 3.5 years now on the carnivore diet. I know I kind of told my story already once before, but I'm going to kind of give you a basic, small, quicker version, I guess, of it. Okay. Uh,
Sure.
so before all of that, going back into like around 45 years old or so, I was quite a bit overweight. Um, Actually, I think I was 44 years old at the time. I was quite a bit overweight, and I found a diet that I started doing to lose weight. I've tried many different diets before, but didn't really have a whole lot of success. I did this diet and it worked pretty good. I actually lost 100 pounds in a year. Uh, the
What were you
problem
doing?
was, so that's where the problem comes in. It was basically the whole restricting what you eat type of
Hmm.
thing, right? So there was really like no sugar, stuff like that. So that's good. Sugar in its purest form, I should say. But there was still carb, some carb. It was kind of low carb, but there was some carbohydrates like from like whole vegetables, stuff like that. And then it was more leaner type of protein. So I wasn't really getting a very good fat content. So as somebody at the time that wasn't very well versed on nutrition, I didn't understand that lean, low fat, and low carbohydrate is a failure for your body nutritionally, right? Um, so I didn't have energy. I lost a lot of energy. I didn't eat much, so my metabolism probably slowed way down, that kind of stuff. But I did lose a lot of weight. But here's the interesting part. I was doing a lot of vegetables and stuff like that, even some fruits, that kind of stuff. and I was in pain a lot. I think I had oxalate dumping issues with eating a lot of baby spinach. I would have, in the place of a breakfast, I would have a shake in the morning that had like 1 to 2 cups of baby spinach in it. And I did that every day. And then there was usually like a lunch that was a very small meal, and then a dinner that was smaller meal as well. So really, I wasn't eating that much. And that is a way you could technically lose weight, but it's the way that I guess most people fail because it's not sustainable long term. And once you go back to eating the way you were before, you're going to gain the weight back. Like, you know, why would you not just gain the weight back if you go back to eating exactly the way you were
Of
before? And that's
course.
kind of what I did. That's what I did. So this was probably like around the 2018 time period at this point. I'm starting to gain the weight back. And I had my very first AFib episode. I was diagnosed with AFib. Now, I was diagnosed with, I say if I say this right, paroxysmal, where
Paroxysmal atrial fibrillation.
paroxysmal, there we go, where basically you go into it and go back out of it on your own. It can be like a couple hours, a day or two, something like that, but you
So,
go back out
sort
of it
of
on
in
your own.
a stuttering fashion.
Yeah. And so that's the type of AFib that I had. Um, got a cardiologist at that point, and over the next couple of years, he's like, it's just going to get worse. Um, put me on medication, that kind of stuff, put me on a blood thinner. And of course, at that point, he was right. It was just getting worse. I also gained the rest of the weight back at this point. So that probably didn't help either. And so that takes me into early 2022, and I was just a mess. Like AFib episodes were happening at least 2 to 3 a week. I'd go into it, I go out of it, then I'd go back into it again a day or two
What were you
later, and I go
what were
back
you
out of it.
feeling at the time? What were the symptoms that you were when you knew, okay, I have my AFib back?
Yeah, uh, it was mostly like a little bit of an extra hard beating or fast beating of your heart in your chest and
Okay.
tiredness.
So palpitations, fatigue.
Maybe even feeling a little hot too.
Okay.
Because I can definitely say that there were times I'd start to feel a little hot, and I'd be sitting in a chair and I'd be like, man, I just seem tired, and I'd be like, wait a minute, let me check, and then sure enough, oh yeah, I'm in AFib. So that's what would happen for me.
Mhm.
Now, obviously, when you're in AFib, you are at a higher risk for stroke because of the potential for, well, first of all, potential for your heart rate getting up too high, but also because um, I know you can't really see where I'm trying to point, but in your chest, in your heart, there's an area that the blood can pool up, and then that could break off and cause a stroke. So that's something that is a pretty serious thing, and they put you on a blood thinner and all that stuff. And the interesting thing is all the conversations with the cardiologist, it was never this type of food is bad for you, or the only type of thing ever was drinking alcohol or drinking something that had caffeine. He said could increase the chance of going into an AFib episode because it increases your heart rate, but never said anything about any type of food. Now, of course, now I know if I ever eat some carbohydrates, my heart rate actually goes up. So I don't know why carbohydrates was never thought of at that time, but it wasn't. So the conversation was always, it's just going to continue to get worse. The main thing we could look at was doing it in ablation, where they burn the areas of the heart where the electrical signals are getting mixed up. And of course, with that, one of the risks is that the part that they have to burn actually is the part that does the beating, and you might need a pacemaker and that kind of stuff. So those are like some really serious risks, and I didn't really want to go that route. And I also was very overweight, tired, didn't feel like doing anything. I just sit on the couch all the time. and I knew I needed to do something about that. And the first thing with that was I said, I know some people that are doing keto and they are losing weight doing keto. So I'm going to try and do keto. So I started to do keto and I started watching uh, Dr. Ken Berry. And I saw one of his videos where he actually talked about AFib and he talked about, I believe it was the vagus nerve and how that can mess up the signals and how what you eat makes a big difference. You need to stop eating sugar, any type of carbohydrates, that kind of stuff. He started talking more and more about carnivore. And after like 3 months of doing keto, where I saw just a little bit of weight loss, no real big differences. I still had really bad joint pain, back pain, stuff like that, arthritis. I still had the AFib just as bad as it was. I said, I'm going to go carnivore. And within a very short time of doing carnivore, the AFib episode stopped. And it's now been over 3.5 years, and I have not had a single AFib episode. After the first year of carnivore, my cardiologist took me off of the medication. He's done different tests. Last year, I guess it was last year, I had a stress test. He did another test this year. I can't remember exactly, some sort of an ultrasound type of test where they measure like the size of your heart and stuff to see if it has gotten any bigger or anything, because that would be a sign that maybe there was still AFib episodes happening that weren't being detected. He had me do a 30-day heart monitor, and there were no AFib episodes tested there. The heart wasn't, getting enlarged or anything. There was no issues there. And then the last thing he just did more recently here was he had me go do a CAC test, and that came back at 0. So he's kind of stumped that I could just reverse it, and he still says it's going to come back. It's just a matter of when, but he has no answer for why I was having so many in a week, and it's now been 3.5 years and I haven't had any. So that's definitely probably the best benefit I have had from going to carnivore, but there's really lots of them. You can probably see just from me talking that I have energy and I'm happy. And before I wasn't, I was sad and I was tired and that kind of stuff. I didn't mention this, but before I started carnivore, I couldn't sleep more than a couple hours at night in bed. And I'd have to get up and go down to the recliner downstairs because my back and my lower back and my hips were so sore that I just couldn't sleep that long. Within probably the first week or two of carnivore, I slept through the entire night. I never have any back pain anymore. Funny story out of this, but not too long ago, like a week or two ago, my wife asked for a back rub. I was giving her a back rub, and she was like, "Tell me exactly where it hurts." And she's like, "Yeah, isn't it like rough where you
Doesn't.
get these certain areas that just hurt?" And I'm like, "No, I haven't had, my back hasn't hurt in 3.5 years. I don't know." She kind of got mad at me for that, but it's like, she doesn't do carnivore. I do. I don't know what to say, but that's the way that I feel now. Like it's so hard to explain, but to actually be able to feel it, that I couldn't sleep in bed, and now I don't have any of those types of issues. Um, I do push-ups now. Like before carnivore, I could probably only do maybe 1 or 2 push-ups. I can do 50 push-ups right now at one time. Yesterday, I did like 120 total push-ups for the day over a couple of sets. And that's something, it's amazing. I'm 52 years old. And when I was 48, when I first started carnivore, I couldn't do any of that stuff. There's no way I could have done that stuff. I didn't want to either. And now I actually want to. So that's kind of the story in a nutshell.
Thank you. So, multiple things. Most of them, if you go and ask most doctors, they will tell you, well, diet won't change that, or what you eat or what you don't eat is not going to change that, right? Uh, so, unfortunately, a lot of the times we're wrong. Now, let me explain a little bit about atrial fibrillation for those that don't know what that means. Obviously, it is a disturbance of the electrical pathways in the heart. Okay. And we have four chambers in our heart. The top of the heart is the atrium, and we have a left and a right side at one. And then we have the ventricles, which are the lower part of the heart, and we have a left and a right side at once. So blood flows through the right atrium, goes to the right ventricle, goes to the lungs, comes back to the left atrium, goes to the that ventricle, goes out the aorta. There's a bunch of valves among these things, to be specific, for valves. And we have coronary arteries around the heart for supply, but we have an electrical system, and it's supposed to. We have a natural pacemaker somewhere at the top of the heart that stimulates the electrical system, and it goes down the heart. With atrial fibrillation, this gets disorganized. Sometimes you develop, which is most of the cases, develop multiple centers of stimulation. So it becomes disorganized. Now you're having stimuli from everywhere, and the top chambers are not contracting like they should. They become very, very disorganized. And the blood pools in the atrium. And whenever you have blood for just a few seconds, you can start developing blood clots when it's pooling. That's where the risk is, because if you develop uh, a clot and a piece of it uh, dislodges and goes into your brain, you get a stroke, because the arteries coming out of the heart are bigger, so it's not going to get stuck in there. It's going to get stuck in the very small arteries of your brain. So when they do an ablation, they go in and they burn some of that electrical system, and sometimes the end result, you overdo it, and you mentioned you might need a pacemaker, right? Because now you don't have any stimuli. Sometimes they do burn enough to stop the other centers and restore good function. So sometimes the ablations do work. And nowadays, there's also, I don't know if they ever talked to you about this. There's a Watchman, it's called a Watchman procedure. Is
Yeah.
sort of a little bit umbrella that they put to stop the clot, and then they don't have to give you the anticoagulants. Were you I did you say you didn't take the anticoagulants, or were you on the anticoagulants for a while?
Um, I was on Eliquis, blood
Okay.
thinner, and Metoprolol.
And the metoprolol controls the rate, which is very
Yeah.
important, because otherwise you can develop uh, contractions at a rate of 150 and higher. And when you go that way, your pump, your heart pump, the heart is a pump, is no longer being effective in what's supposed to do.
Yeah.
So you can end up in a complete cardiac arrest if that goes for a while. Anyways, that's to try to give some understanding to the people. So I have a question here. So let's see. Lois, when you go into AFib, do you need to go to the hospital? Well, the last time you went into AFib was a while back, but
Yeah. So I have gone to the hospital a couple of times. The very first time, because I really didn't understand much about it. I didn't even know for sure what it was. I
Mhm.
just knew that I didn't feel right, and my when I took my blood pressure with a home kit, it said I had an irregular heartbeat, and I couldn't seem to get that to go away. So my wife took me to the emergency room, and they hooked me up to a machine, and they're like, "You're an AFib." So that's how I found out I got AFib. So that was the first time, and uh, so I was in the hospital there from the evening until the morning, and they said in the morning if I wasn't out of AFib, they were going to um, shock my heart back into rhythm, which is like a cardio version where they shock your heart back into rhythm. But late, like overnight, I went back into rhythm on my own, normal rhythm, normal sinus rhythm. Um, I don't know if I should say on my own because they did have me hooked up to an IV that had fluids, for your electrolytes, and also they were giving me the metoprolol through that IV. So the combination, I think, is what helped me to get out of it. Um, One thing that I kind of found on my own was that if I relaxed and I drank water, I could usually get out of it within a couple hours on my own. So I didn't really go to the hospital very often. But there was one time, and I think this was probably right around 2020, 2019, somewhere in there, where I didn't seem like I was getting out of it. And I went back into the hospital that evening. And in the morning, I was still in it. So they did shock my heart back into rhythm that morning. That's the one time that they had to do the cardio version. Those are the only two times that I went to the hospital for the AFib.
So it could be a medical emergency if it persists, especially for hours, because you can deteriorate and uh, it can become something you don't want to see or have. Uh, but the type that you had, which was what we call a paroxysmal atrial fibrillation, comes and goes. Some people develop atrial fibrillation; it's just a permanent thing,
Mhm.
and you need medications. Number one, anticoagulants to decrease your stroke risk, and things like metoprolol, which is a beta blocker, and it basically slows the heart rate down because you don't want to have that very high rate, anywhere
Yeah.
between 140 and 200. You might still be able to tolerate it, but it could go higher, and it's never a good thing. So, and now you have put it into remission permanently for over 3 years.
Yeah.
So, this is a comment, not a question, but I want to bring it up. So, Uncle Charlie says, Doctor said I will be on insulin the rest of my life. She was wrong. Was 193. I'm assuming that was the weight. She said, don't lose no more weight. Don't eat red meat, no more eggs. So stay away from red meat and eggs. What do you think, Brian?
Well, well, no offense, Dr. Nelson, because you're a doctor, but um, everything that I have learned is that doctors do not get nutritional education in school. I believe they get one semester that's based on nutrition, and that's basically how to keep someone alive if they need like a feeding tube, that type of thing. So it's kind of crazy that doctors don't get this type of education.
Well,
But
this is
I,
the thing. This is the thing. Yes, there's not a whole lot of time because you have 4 years to learn a lot of material. But even
yeah,
if we got a lot of education at par with registered dietitians, we're probably gonna be getting the wrong nutrition information.
right. That's what I was gonna say next. Yeah. Uh,
All right.
yeah, it's It's funny because I actually know somebody that has diabetes, and their doctor told them that they don't want their A1C getting below a certain number. And I said, well, why? You want your A1C to be better. And the only thing that I can come up with is that the doctor doesn't want to deal with having to mess with their medications.
So I'm going to be very blunt. So if you know a doctor, clip this and send it to them. That is being stupid and misinterpreting the data. Okay? So some studies have shown that when you aggressively treat diabetics, in particular with insulin, when your A1C goes down, forced by insulin and other medications, aggressive, intensive medication therapy, when the A1C goes below a certain point, you actually have more incidence of cardiovascular risk in particular. Okay? So outcomes are worse. What was the key here? Intensive medication treatment, in particular, insulin. Okay? There is no data that shows that if you get your A1C down to, let's say, 5.4, that you will have an increased risk of complications. If you do it with a very low carbohydrate diet or a carnivore diet, you will reverse diabetes and you will not have those increased risks. So I have heard that before. Fortunately for them, it hasn't been in my presence that they said something like that. It's from patients like or other people that have heard the doctor say something like that. That doctor is misinterpreting completely the information. Okay. And doctors are smart, and doctors listen, if I'm having a heart attack, I want to go to the emergency room and have a good doctor try to save my life.
Mm-hmm.
Okay. But there is absolutely is not a problem decreasing your A1C when you have done is essentially stop eating the stuff that is making your blood sugar go up, and your A1C will eventually come down. And listen, if it goes down below 6.5%, you can call it whatever you want, but basically you have reversed what gave you the diagnosis of diabetes, right? So it's
Mm.
incredible that some doctors will, oh, don't get your A1C too low when you have done it with just diet. It doesn't apply. It does not
Yeah.
apply. Anyways, uh, so Chris asked, Wick, what will you tell people who are comfortable with being where you were as opposed to now?
So that's a good question. Uh, but I guess the first part of that is that no matter what you try and tell people, until they are ready to do something, they're not going to do anything. And I know that from personal experience. If they're not ready to do something about their life and how they're feeling, it doesn't matter what you tell them. It doesn't matter what they've seen from you. It's not going to get them to change. They have to want to do it themselves. Um, so, Dr. Nelson, let's bring up the one picture that has me sitting on a couch, and then the other one. Let's bring that up really quick. Yeah. So, the first picture there is from like 2020, 2021, somewhere in there. So, it's about a year or two before I started Carnivore. And I was a very miserable person. But here's the interesting thing. I just thought that that was what was expected, that that's what life was like. I was
You're
getting
getting
older.
old, right?
Yeah. Yeah, like, you just think like, "Okay, I'm getting older," and that's part of aging. Now, the next picture here is, like, that's on the right there is, like, a year into carnivore. And then here, this was probably around the same time frame, 2020, somewhere in there, and then this was about 2 years into carnivore, the difference that I had. Um, and again, you look at those pictures of me when I was bigger, I'm obviously way inflamed. You probably can't necessarily see it, but I am in
Well,
pain.
you do
I'm
look like
not
a
feeling
different
good.
person. I'm sorry. You show me those two pictures, and I'm not going to instinctively think, "Oh, this is the same person."
Same person, yeah.
Yeah, I
But, I mean, that's it, like, I didn't feel great, but I didn't know at that time that I should feel good. I just thought that was part of the aging process, and I think that's where a lot of people are, and I say this a lot, that I think for anybody, and this is definitely what happened with me, what really allows you to be able to be successful with something like the carnivore diet is when you feel like you've hit rock bottom. And that's how I felt back in 2022. I felt like I hit rock bottom. I just had no energy to do anything. I just, I didn't, to be honest, I didn't know how much longer I was going to live. And maybe I'd live a few years or something. I don't know. But I had kids that I had 3 kids, and I didn't know if I was gonna be able to still be around and watch them get married and have kids of their own and have my own grandkids and so forth. And I turned that into my why when I started doing carnivore, really. Maybe a little bit with keto, but definitely really established it in carnivore that my why was I wanted to get healthy so that I could watch my kids grow up, get married, have kids of their own, where I'd be a grandfather and I could literally get on the ground and play with those kids, that I could grow old with my wife. And after I retire from the normal job that I do, that my wife and I could go out and go on vacations and see the world and stuff. And I wouldn't have to be in so much pain because that's where I was back then. I was in so much pain. And it wasn't until like I said, I hit rock bottom that I was able to do this. And now I look back at that and it's like, I can't believe that the way I felt back then is not the way it's supposed to be. Like, you're not supposed to feel that bad just because you're aging. I feel better now at 52 than I did when I was 30.
It's amazing, isn't it? By the way, this is his channel. You can search by his name, which is unique. You won't find too many people, Brian Nowicki, in YouTube, but his channel, Week Goes Carnivore, and I think Lois had uh, put the address in the chat. Thank you for that, Lois. And we do have a question from Lewis here. So does AFib event go away or stop on its own normally?
Yeah, so for me, it does. So, as Dr. Nelson was saying, if you have what's called persistent AFib, that means that you're in it pretty much long term and you need some sort of medical intervention to get out of it. Um, so for me, I had and again, I'll butcher it, paroxysmal. Did I say that right?
Paroxysmal.
Paroxysmal, paroxysmal AFib, which essentially with it's diagnosed or it's defined as that you go back out of it on your own within 7 days. For me, it was typically a few hours, sometimes a day, something like that. But normally it was like a couple hours or so, and I would just naturally go back out of AFib into normal sinus rhythm.
All right. GFG Homestead asks, do you feel that stress contributed to your condition?
I think that stress is definitely a big part for people with the type of AFib I have. Just like if you have trouble saying that, I'm not going to say. I'll just say the type of AFib I have. Uh, stress, I think, is very big. Alcohol, caffeine, those kinds of things are big, and then just carbohydrate intake, um, electrolyte imbalance. If you, let's say, your sodium or your magnesium or potassium is off, sometimes you notice you have some skipped heartbeats, which is technically a, a faster heartbeat for like, 2 heartbeats, whatever. Or you just notice an increase in your heart rate. If you notice those types of things, those are all things that can put you into an AFib episode. So I think all those things definitely can contribute. And stress definitely raises your heart rate. If you feel really stressed out, check your blood pressure. Your blood pressure might be higher than normal, and your heart rate's usually up. So yes, I believe stress definitely plays a role there.
All right. So I have a question here. I'm going to ask you. I did ask you backstage. I'm going to put you on the spot. Who was the most inspiring person you've interviewed on your channel? Because you also do a lot of interviews in your channel.
Yeah. I'd say that the most inspiring person I interviewed is Sean White, intentional carnivore. This was back a couple years ago when Sean had lost a lot of weight really quickly. He got rid of diabetes, all that kind of stuff. I mean, he had, I can't remember the exact amount, but it was over 100 pounds. Wasn't it like 150 pounds or something like
It
that?
was it was a lot.
It was a lot. Yeah.
Yeah.
And interviewing him, I actually did an interview was so long that I broke it up into 3 video segments. And each video segment was about 40 minutes, a half hour to 40 minutes long. That's how long the interview was, because it was just easy to talk to him. And he just sounded like, in his voice, it was just so inspiring to hear him and to hear his story and how he did it. And basically he was just doing, beef, butter, bacon, and eggs, I believe is what he was doing. And that's all he did to eat. And he lost, a ton of weight. And again, his voice, just how he came across as just a regular person like any of us. He didn't sound scripted. It sounded like it was coming from his heart and everything. And that was just so inspiring. So I'd say he is probably the most inspiring interview I have done on my channel.
All right. Thank you. You did mention another name. What was it?
Dave Mack.
Dave Mack.
So his channel, I believe, is called Zero Carb Life or something like that, or Zero Carb. But he's Dave Mack. You probably all know him. He's the one that interviews like everybody, right? I think I know he's done over 1,000. Is he over 2,000 interviews now?
I think he might be close to 1,500 right now.
1,500. Okay.
Different people. And
yeah,
I'm one of those 1,500. You are as well, right?
I think I've been on there 3 times.
Okay.
So yeah. But so here's the thing with Dave. When I first started Carnivore, I started out like I was watching Dr. Barry, right? And then I found some other people like Dr. Baker, just some of the different doctors and so forth. And he had just started doing his channel, and it was kind of my first experience as somebody that was saying, hey, I'm doing carnivore type thing, right? And this is like benefits I'm seeing. And he was kind of maybe a couple months ahead of me in terms of where he was at on his carnivore journey. So to me, that was very intriguing. And I got really inspired from him. And if there is like a carnivore idol for me, it would be Dave Mack. So I've always looked up to him, and I've always watched his channel. I love his interviews, and that he brings in so many different people that, somebody out there has an experience that's going to be similar to one of those interviews, and they're going to watch that, and it's going to help them. And then the other thing is he'll do other videos that aren't necessarily interviews, where He just makes a lot of sense. Brings up some really good points, and I really love his channel.
So going back before you started, what was that light bulb moment or health scare that made you realize the standard diet was no longer an option for you?
Uh, so I don't. I've never really fully talked about this, and I don't want to talk completely because there's a personal thing to this. But I will say something happened. Um, something happened in my life where it it really affected me and made me really sad. And for a few months, I was just really, really sad. And I knew that I couldn't keep going that way. Um, and I don't know that I can say outside of that that there's really that one particular thing. Like I mentioned, like I felt that I wasn't sure I was going to be able to watch my kids grow up, and that was a big thing. This might sound stupid, but sometimes I'd go to bed and I would say to myself, I'm going to live a long life and watch my kids grow up and have a long life of their own. And um, I would say that because I was afraid that I wasn't going to. And I guess all those things just kind of added up. And I just knew that I had to do something. I can't necessarily pinpoint and say, like, this one great thing was the thing, you know?
Well,
Um,
sounds like
and yeah.
that was the thing. All right. So you went carnivore. Did you have any keto flu, carnivore flu? Did you have any struggles at the beginning?
A little bit, but not that much. So I started going to keto first in the spring of 2022, and I didn't really notice an issue. I think if I look back at things, I probably wasn't quite as keto as I thought. Like I was probably a little bit higher on the carbohydrates than I thought, but at least it was more whole vegetable type or whole, probably not even fruit, mostly whole vegetables. Um, but that probably wasn't as strict keto as some people are. And I think because of that, there was a pretty good transition for me. But I will say that first week or two of carnivore, I did have a little bit of a bathroom problem. Not very bad, like a lot of people talk about. And I think it's because I kind of transitioned. Um, I didn't notice any any issues with being too tired or anything either. And for the most part, I didn't really have the electrolyte problem because I did a lot of research ahead of time and I knew that I would need to watch my electrolytes at first because my body would be peeing out excess water that was being held by the carbohydrates. So I didn't really have that type of an issue. So it wasn't too
Okay.
bad.
Yeah, not everybody does. Not everybody has problems. Uh, I never had any, well, except for the looser stools when you increase your fat. But I never had any
Mm.
problems transitioning, and I have done keto at least multiple times in the past 35 years. And then even when I went strict keto, went carnivore, like don't know what the keto flu is, basically. Um, what would be your advice when you're talking to someone who might be interested, and we might have some people here who are interested in trying the carnivore diet?
Yeah. So I think, first of all, now that there are new US dietary guidelines, it it makes things a little bit easier because we can actually say, well, if you look at those U.S. dietary guidelines, you see like a ribeye steak way up at the top. You see
Hmm.
eggs, you see full fat dairy, that kind of stuff. If you read the descriptions on stuff, they're talking about the full fat dairy, they're talking about meat, eggs. Um, to basically say not to be so concerned about saturated fat. I think they talk about fermented foods a little bit, that kind of stuff. And they say that you need to cut out as much as possible the added sugars. And I think that's a good start. I think that everybody has to find what's going to work well for them that they're going to be happy with, because if you're happy, you're going to be successful with it. If you do something and you just aren't happy with what you're doing, it's going to be hard to be successful. So if somebody has to ease in where they're still eating some of those carbohydrates that they shouldn't be, and that's how they are happy and it gets them started, then that's great. And it might be that at some point they realize, you know what, I have to actually go down to zero carbs and basically just doing the carnivore diet. And if not, that's okay too. At least they're getting healthier than they used to. But a key is getting that, as RFK Jr. said, real food, the whole food, right? Um, all of these, like, I think it's somewhere like 85 to 90% of the food that is in the grocery stores didn't exist like 50 years, 60 years ago. They didn't even exist. Those are all made up foods. They're combining a bunch of ingredients, and look what it's done to everybody's health. It is destroying our
Absolutely.
health. It's making us
So,
age quicker than we should.
how has your relationship with hunger changed?
Hmm. It's definitely changed. When I started carnivore, I would see some videos of people talking about only eating once a day, and I was like, "There's no way, they're crazy. There's no way I could do that." And I was able to do 2 times a day successfully, but over time, I got to the point where I was just eating 1 meal a day, and then it's kind of gotten to the point now where it just kind of depends on how I feel and when I get hungry. Sometimes it's once a day. Sometimes I'll have a second meal if maybe the first time I just didn't have enough food to fill me up all the way. And then there are times now that I'm actually doing some fasting, and that kind of is even crazier yet. I'll do like 48 or 72-hour fasts, but the interesting thing that I find there is right around that 20 to 24-hour time frame, you get a little hungry when you say you're going to do a fast. But once you hit 24 hours, it seems to go away and you're good. And I can do the 48, I can do 72 hours, and it's no problem. Now, for me, I've never wanted to go past 72, so I haven't tried to experience that. Um, but I'll eat it. I'll eat at 72 hours and get
And
back to
I,
eating at
you
that
know,
point.
that's great. 72 hours, it's great. And I think it's helpful if you don't know anything about fasting. Please check out Dr. Jameson Fung. He's got a lot of good information on that, but you don't, you're not going to die from not eating 24 hours or 48 hours or 72 hours. In fact, there are people who routinely do longer fasts, and there are many people who may do a 40-day fast. And we just had a member of the Kilsmati tribe finish a couple of days ago her 40-day fast, and she's been doing it every year for a bunch of years. Okay. Uh, I had decided to fast on Monday, yesterday, and my last meal had been dinner on Sunday. But then late in the day yesterday, I was getting a little bit hungry. It was 24 hours. So I had some picanha steaks.
Mm.
but I have done certainly a little bit longer fast. My longest was 22 days. Everybody doesn't need to
Wow.
do either 10, 2 weeks, or, you may want to do it for several reasons. Uh, but I think if you throw in a regular fast, uh, at least one day every week, or maybe every month, 3 to 5 days, or seven, on some sort of regular schedule, I think it's very helpful for multiple reasons.
Hmm. Yeah, I agree.
So, how do you handle social situations? What do families say? What did they say before? I'm sure they're used to now, but what did they say before? Uh, friends, family, friends, extended family, or even any other social situation, like you may have a work function or something like that. How do you handle those situations, and what do they say?
Yeah, so for me, there weren't very many conversations in the beginning. There were just a few people that actually knew that I was going to carnivore diet um, within the family. And I'm the kind of person that did a lot of research before I actually did, took action in going to carnivore. Um, so when I say that I'm going to do this and they say things like, well, that's actually not good for your cholesterol or whatever, I had like research to back why I don't believe that cholesterol is the problem and why other things are and so forth. And then I probably lost, I'd say it was about 60 pounds in the first 3 months. I lost a lot in the first 3 months. Now, I haven't lost as much since then. It's been very slow since then, but that first 3 months, I lost a lot of weight. And with that, most people notice right away something was different. So if I talk to people and I said what I was doing, normally they would just be, "Oh, okay." And I don't know what they thought about it, but they at least didn't say anything to me. Some people, like, within the family will be like, "I see the changes. I see you look healthier and so forth, but I'm still just not sure about the long term." Um, and it's like, "Okay, I disagree, and I got reasons why." And I would say probably too for the last year or two, I would send different videos from different doctors and research and stuff to people, showing them why their thinking was wrong. But I kind of got to the point that I've stopped doing that because I found that even though I might want them to eat the same way, if they don't want to, it's not going to change anything. And if anything, it was just making them upset with me. So I don't really talk about it that way anymore. Now, I will say, if I go to like someone's house where we're going to eat, like if there's a party or something like that, people have been very, very accommodating to me. And they'll say, "Hey, I got some extra meat here that you can eat. Um, don't worry about the other stuff that's here, like the desserts and that kind of stuff. But there's plenty of stuff that you can eat." So people tend to be pretty accommodating. Um, and I don't know if it's just the people I tend to be around, but they don't really try and persuade me away from eating this way. So, and the
Well,
one
I
or two
mean,
doctors that I had that were before aren't my doctors anymore. So I I don't know.
so you had atrial fibrillation, you were uh 85 more pounds, you were miserable. uh Now you have no longer AFib for years now. You feel happier, you've had weight loss, you're have better sleep, you have more endurance. You mentioned you've been able to exercise more. Is it all about the weight, or is it more than just getting some weight down?
It's more than weight. And this is one of the things that I try and talk about on my channel all the time. that people shouldn't be so concerned about their weight. They shouldn't be worrying about the weight on the scale. It's about getting healthier and getting rid of body fat, visceral fat, stuff like that. That is the key, is getting rid of that stuff that causes inflammation in your body, causes you to feel older as you're aging and so forth. Um, it really is. It's the health thing. And like there are people that want to come to carnivore because they want to lose some weight. And that's great. And maybe they'll feel so much better health wise that they're going to stick with it because they're going to be like, wow, it isn't just about losing weight. Because this isn't really necessarily a diet to lose weight. This is a way of eating. Everybody that does this is just how they live their life anymore, you know? It's what they know, that they want to stay away from all that really bad processed food and the sugar and all that stuff because they know that that is poisoning us and hurting our bodies and making us unhealthy. So that's what it really is about. And for people that start doing carnivore, and I will do this sometimes where I get upset that I'm not seeing a change on the scale, you need to forget about that. Look at other things. Look at how you feel. Look at if maybe you had diabetes and now you're at like a pre-diabetic level or something like that. Look at measurements with it's funny because I have right here, but if you have a one of these tape measure things, you know, um, take measurements within your body and see if you're seeing changes. Like I have in the last year, I have seen very little weight loss on the scale, but I have seen changes where my waist size is smaller. And in some cases, like my arms are actually bigger now because I do some working out and I'm gaining muscle. So it's about those kinds of things. And a key thing I think that people need to remember with as you age, one of the things that is the worst for us as we age is that we lose muscle. So if you can do some kind of exercising, whether it's like I've been doing push-ups, some people like to sprint, some people like to walk, some people walk with like a weighted vest on, whatever it is. If you can do some of those things, that's going to help you to maintain muscle strength, which is going to help as you age as well. And those are all health related things. Those aren't really necessarily how much you weigh.
So we have a question from Carnivore Jerry, and Jerry is the one who did the 40 days that ended. She ended it last Sunday, I think it was 2 days ago. And she asked, "Will you ever do a dry fast with?"
So I never have. I've always drank water when I was fasting. Um, I don't know if I would. I mean, right now I don't have a desire to do it. I can't say that I never would though, but if I did, I'd probably make sure that I had medical supervision. So if I knew somebody medically, like a nurse or somebody like that, that I could check in with, especially if I'm talking like we're talking doing like a 5, 7 day type of dry fast. Um, I would want to make sure that everything was right medically, that I wasn't, because some people actually have a hard time with doing that. They can't do that. Their body starts shutting down. So
All right. This is a comment, not a question, but Simpson John, my fancy scale shows that I have gained over 5 pounds on lean body weight, but my total weight loss is a bit over 1 pound a month. Talk about slow weight loss. Well, like we're talking, it's not all about the weight loss because many people, when they, so the carnivore diet has two parts: what you eat and what you don't eat, right? And they're both important, I think. If you're eliminating a lot of stuff that's making you sick, you're going to be feeling better. There's no question about it in my mind. When I feel myself as well, better than I have probably at any point in the past 30, 40 years. And so I'm also hopeful that I'm going to live a long life. And even if I don't, I am, my quality of life is so much better now than
Mm.
when I was sick, diabetes, hypertension, multiple uh, improvements, and that sense of well-being, right? All righty. So we are past the 1 hour mark. Uh, if someone wants to get in touch with you, of course, would this be the best place to go to your channel, subscribe?
Yep, they can do that. I think they should be able to find my email address on there as well if they want to email me. And I'm pretty good about getting back to people. Or I'm on Facebook too. It's just Brian Nowicki. And I always post about like carnivore related stuff and health related stuff. So probably easy to find that Brian Nowicki. So
All right. Well, thank you very much for being here with us. You all have a great day. Those that are members of the Kilsmati tribe, we're gonna be here at 5:30 again. So in an hour and a half, not here. We're gonna be in a Zoom meeting with the community. If you want to be a member of the Kilsmati tribe, it's free. Search for Kilsmati tribe. Go to the description of the video where you're watching. The address should be there. Become a member. It is free, and at the we have either 2 or 3 Zoom calls every week, and we'll be there tonight at 5:30. So in an hour and a half. Again, thank you, Brian. Do you have any last words?
well, again, thank you for having me on the live stream today. And, in terms of last words, I would just say um, for anybody that's watching this and is struggling, let's say you're trying carnivore and you're struggling with it. If you don't already have it, make sure that you have a very personable why for yourself, something that just is really passionate for you specifically, not necessarily a goal, but a reason why you would be wanting to get healthy and lose weight. And remind yourself of that every day. And it might sound stupid and you might want to do it when nobody else is around, like right before going to bed or right when you wake up, but literally say it out loud and remind yourself of it every day. It's going to become part of your conscience and it's going to help you to get past those struggles and have success with the carnivore diet.
Well, thank you again, Brian. Everybody, you have a good day, and I'll see you, some of you at least, in an hour and a half. Bye bye.
Bye.
Eat meat.